Hi, everyone. Thanks for joining this webinar on a lovely Thursday evening. We're really excited to be hosting this webinar, and I'm genuinely excited to hear Martin speak. I'm Hannah. I'm a dentist, and I'm one of the founders of Kiroku. I started the business because I was so stressed and frustrated with how much of my time was spent staring at a screen, writing variations of the same information over and over again. If you haven't heard of Kiroku, we provide AI-powered software for dentists to help you write your clinical notes in a fraction of the time. I am also super excited to tell you about the release of Kiroku Docs, which allows you to generate any document, for example, treatment planning letters or a letter back to a referring dentist, in the click of a button straight from your notes. And I think Martin is going to be showing you a sneak peek later. If that sounds like something that could be making your life easier, please sign up and create a Kiroku account at the website. And I think that the link to the website will be sent out later on in the webinar. So docs will be released more widely at the start of October, but you can get your docs automated much quicker if you're already set up with a Kiroku account for your notes. So create an account and give it a go. I'm handing now over to Martin, who needs no introduction, an insanely experienced clinician and a world-renowned speaker on the topics of both implants and digital dentistry. So we're super lucky to have him. And also, he's also one of Kiroku's earliest customers. So Martin, thank you so much for being here. I will hand over to you.
Thank you so much for that kind intro, Hannah. I remember coming across Kiroku and Hannah when she popped in and she said she could save me a load of time writing notes, and paperwork is one of the things that I think we all have to do, but it's not something I enjoy. And certainly Kiroku is something that I use every day that I'm at work, and all of our team use. And I'm really, really excited with this new development that I'm going to show you called Kiroku Docs and show you how that works. And before that, we're just going to generally talk a little bit about technology. So it's not just about the one thing. So over the 45 minutes, we're going to talk a little bit about technology. We're going to talk about how we use basically our data gathering process and how Kiroku forms a part of what we do at the practice on a daily basis and actually makes us write better notes quicker, is how I put it when people ask me, and that really saves time. So really, without further ado, I'm going to start off just by saying that really, if we look at what happens around us in the world and we look at our profession, we realize that the technology around us always influences our work, and it's the same for us as dentists. And if we look at what's happened in the past, I'm going to touch a little bit on that, and actually how adopting technology is one of the things that's really, really key to us being able to carry on working efficiently, effectively, hopefully happily, and hopefully a little bit more safely. A little bit about me. I'm a wet finger dentist. I hate that term, but that's what people say. So 3 days a week, I find myself in that room working at placing implants and restoring implants. Alongside that, I have different teaching positions. One is at Penn Dental Medicine, the other is at Goethe University at Frankfurt, the others with the Royal College of Surgeons. But really, aside from that, I'm a wet finger dentist, and I've spent a lot of my time doing dentistry and also traveling and talking. Now, if you have a look at these two pictures in front of you, the interesting thing about this is that there is about 4,000 years between them. Tooth replacement has always been something that people have chosen to do. And again, if you look at these two pictures, what you can see is an ivory denture, which has been carved, and teeth that have been put on little pegs that are there. And what you see on the other side is you see a modern FB1, that's a zirconia bridge. So tooth replacement is not something that's very new. It's something we've always desired. And if we just look back for a second, and we, talking about digital dentistry, one of the things that we realized is the digital age really began, maybe some people would argue in 1971 with the first CT scanner, but really in 1983 when intraoral scanners came onto the market. And if you have a look at the picture of those gentlemen in 1985, you see the technology around them was what they used to enhance the work and what they could offer patients and the work that they could do. Now, actually, these things are everywhere and the technology is everywhere. And my point within this is that in some ways, one of the parts where we're still not using technology and AI so far has been note-taking, which I think sounds basic, but it's something that's important. And really, how do we bring our practice up to speed with using the technology that's out there in order to allow us to work more efficiently and work more effectively? So the other thing to bear in mind is if we look into the future and we look at how technology is going to change what we do now and what we do in the future, what we realize is the future is digital. The genie is not going back in the box. We are going to continue making more and more of these computers. We're going to continue using it more. Technology is going to infiltrate everything we do in so many different ways. And as a part of that, what we realize is we're living in something which is the digital revolution. I'm just going to let this slide play and let you read it. Just take a moment to understand that. The digital revolution is far more significant than writing or printing, and we are living through it. And the other thing about it is we're living through a period of exponential growth. And in order to show you that, what you can see here is a slide, and this slide shows you the basic storage in your iPhone between 2008 and 2020. This was in about late 2018 that I took this. And the interesting thing is when you look at that, and as far as you're concerned, you know, the storage in your phone has been slowly increasing, but not in a way that's significant. But if you look at the increase, so there you had an 8 GB phone, there you had a 16, there you had a 32. Now, if we look at how long it takes each time, so the first time it takes you a year, or Apple a year to get you 8 GB, then it took Apple a year to give you 16 GB, then it took 2 years to get 32 GB, it took just over 2 years to get 64 GB, just under 2 years to get an additional 128 GB, just under 2 years again to get, you know, an additional 256 GB. And when you get all of this and you look at the rate of change of the storage in your iPhone, you end up, when you look at it, putting it on a curve, and that curve looks like this. That's an exponential curve. So the reason for talking about this is the technology around us is going to carry on growing exponentially. We are in the middle of this, and we need to take advantage of that as dentists. We need to use it in our daily practice. We need to take advantage of the everything that's around us so that we can optimize what we do in practice. So if we just look, and one of the lectures I've given, which I'm happy to send you a link to if you've got my details, talks about how we look into the future. It's in some ways, it's my speculation as to the type of technologies that we're going to find useful or that are going to change how we work in healthcare. Also, if you're interested, I collate a Flipboard page, and on that I talk about all these different technologies. So again, just do message me or get in touch. I can point you towards that. But there's certain technologies that are going to hugely influence how we work in healthcare. Augmented reality, stem cells, 3D printing, nanotechnology, blockchain technology, and the one we're going to touch on today, artificial intelligence. And this has become a lot more of a hot topic recently. It's become a lot more of a hot topic because people have started to realize what it can do. And we've realized there's different types. We've got something like artificial narrow intelligence. This is something like on your scanner, as you're carrying out your intraoral scan, the fact it cuts out all the lips and cheeks. It can only do one thing. It does it very well. It allows you to scan quicker when you're using your intraoral scanner. You've also got something where you've got an element of machine learning. So as you've got, this is machines that can learn, but they can learn only based on information we give them, and they can get better and better based on that information. And what we're really, I think the scary part, and it's called the cingulum, the part that people are worried about, is something called an artificial superintelligence. And this is artificial intelligence that can teach itself and can teach itself what it wants to learn and can do this independently of any inputs. And this is one of the debates that goes on about things like ChatGPT, where I think we're about to release ChatGPT 5, and all of the other large language models that you see out in the marketplace. So if we just go back to AI, bring this back a little bit to dental practice, bring it back a little bit to what we can do. There's all these ways in which within practice you can use artificial intelligence. You can use it to help you diagnose better. You'll see an example of that later. You can you can use it for your planning. So typically in implant dentistry, what we see now is if there's certain planning centers where you'll send your CT scan and your intraoral scan, and the proposal that you get back is generated by artificial intelligence. If you're using aligners in practice, the initial proposal that you're getting back is generated by artificial intelligence. So actually we're finding that actually this is something that's quite commonplace. Record keeping, we're going to talk about in a second, and I'll touch on that. And education. If we think about having the perfect teacher that knows every time you take a test what you need to learn better, how you can learn it better, and has the benefit of having taught thousands of people and knowing how they work and actually knowing which parts of the education it can improve, which part it needs to do more work on. That's really where artificial intelligence will start to come into play within education. And within marketing, you can think about the fact that now we're at the point where a lot of the text you see on Facebook adverts, Instagram adverts is generated by AI. And we can see how actually the targeting and understanding that used to be done instinctively now is really going to be done by machines who understand humans far better than any human can. But if we look at diagnosis, this is one of the things that really, really surprised me when I looked at. So this was in May this year. ChatGPT successfully passed a radiology board style exam. It was able to pass a medical exam with a pass rate of, basically with a pass rate of 81. Now, one of the things that if you think about how many of you got 81% in your dental exams, you'll see that actually there's only a matter of time before large language models such as this are able to actually help us think and maybe think better for us. But that's really another part. What I'm going to touch on now is a little bit about what we do in the practice, and I'm going to talk about our procedure for implant planning and information capture for that. The reason for this is I want to show you how, when we capture this information within the practice and we use it within the practice, how we can use Kiroku specifically to actually help us gather that data, collate that data, and use it better. So, why do we use Kiroku? What are the advantages to us in practice of using Kiroku? Well, if we think about this, and if I look back at, I think it's probably been over 4 years since its inception, I've been using Kiroku. I'm not sure exactly how long that is. I'm sure Hannah will correct me in a second. But the reason why it's useful for us is because once you sit down and you work out what information you want to capture within your consultation and you put it into basically a Kiroku summary, it allows you to systemize this. So when you go back again and again and again, you're capturing information, the same level of detail. No matter if you're having a slightly off day, if your nurse is having a slight off day, you won't forget to look at something. You've got a formula that your nurse can click through and she can prompt you to actually go through this and actually capture all the information you need. And this actually means that you have a much more complete record of your consultation and your treatment with your patient. It also, the other part is involving the nurse. We're very interested at 10 Dental in involving members of the clinical team in the practice. And one of the things that we get them to do is we get them to help with the scanning. The other thing that's really, really useful is to get them to help writing your notes. And this means that at the end of the day, no longer am I sat there trying to remember what I said to this, what I said to the patient, with only a BPE score in front of me and some notes scribbled on a post-it note to try and remind me. I've got a really, really accurate information of that consultation. One of the things that really, really drove this home for me recently was I worked with a temp. And this was the first time in a long time I'd worked with a temp. And she came in and I thought, you're going to have a really difficult day here, because I had a day of consultations. I thought, I'm going to pretty much at the end of the day, I'm going to spend an hour and a half at the end of the day going through and writing all the notes for all of these consultations. I walked her up to the screen, showed her the computer and said, listen, here I use this program called Kiroku. And she looked at me and says, yeah, I know it. The one where you just click on the boxes. Yeah, I can do that. I can do that. No problem. That moment made me realize that actually it means that you can work with any nurse and you can capture the same detail of information. They can guide you through the information you should be capturing in your consultation so that the end result for the patient is consistency. And that's where I think things like, Kiroku and that's where Kiroku has been really useful for us in practice. So involvement of the nurse. Efficiency. I mean, I'm going to tell again another little story with this. We had a dentist join the practice recently, and when they joined the practice, I was talking to them about how they're getting on. And one of the things they said is, look, they really enjoy working in the practice, but they find they're up writing their notes until 10 o'clock every evening. They're sat there trying to remember what they've said to whom, writing it down. They've just got bits of information in different places, or they've got a Word document which they've splurged on and they have to tidy it up into something that's legible and following. And I said, why don't you use Kiroku? She said, what is Kiroku? So promptly she logged on, got a trial, used it for a while. Her trial expired and I went back and, she seemed to get on well. I went back maybe about a month ago to find out how she was getting on. And she was back again saying, look, I'm working really late, and her trial had expired. And it was her realization that she was saving over an hour a day of every clinical day by having something like Kiroku to capture the notes, that she captured the information accurately, so that when she was doing her notes didn't become something that took hours and hours. They became something that she could do efficiently. And that was one of the things that really, really drove home to me the improvement in efficiency that you can get. The other part, which is really, really heralded by the improvements in Kiroku docs, is to speed up external communication. Generally, and if you're doing restorative work, patient comes in, they need a filling, they need a crown, you don't really need to go into great detail. You don't need to give them a personalized consent form. You can just book them in and get on with the treatment. Everybody that needs an implant in our practice gets a personalized letter. This personalized letter takes a while to do, and everything has to be systemized in such a way that I spend a lot of my time preparing and collating and sending these letters. If there was a way of doing this, wait till the reveal later, so that from the notes, I could actually send the letter to the patient and even to the referring dentist, all from gathering the information once, gathering it efficiently, and then being able to disseminate that information in whatever format I choose to all the different parties who need to be aware of what's happening with this patient. That's the patient, the referring dentist, whether internal or external. That really is a massive win for us. And really, I think the key part is what I said at the beginning: better notes in less time. That's really, really why we use Kiroku, and that's why it's efficient in our practice. So I'm going to go to something clinical, and then I'm hopefully going to show you again how Kiroku works, and then a demonstration of Kiroku docs. But let's just start off with a gentleman who's come in looking to improve his smile. He has some teeth that have issues. We're not going to see his case and how I treated it, but really this is just to demonstrate the sort of things we're looking at. And you can see how part of the consultation and information gathering that we do then leads into the notes, that then leads into the information gathering that we're going to talk about. So when the patient comes in, what are we looking at here? We're looking at their glands, their nodes, the TMJ, the muscles of mastication. We're capturing all that information as we're examining them from the outside. As we look closer in, the next thing we're looking at here is the smile line to see, is it high, is it low? What are we going to need to do? Just so you're aware, it's the upper right one that needs to be replaced. There's also some orthodontic treatment he's considering. So we're looking at that, and we're trying to gather that information. As we go closer and further into his mouth, at this stage here, when we're looking here, we're looking at the soft tissues. So we're looking at the quality and quantity. We're checking for any pathology on the soft tissues. We may keep a quick eye on any frena that are present. We're also looking at, we're looking at the biotype at this stage. Looking closer, looking inside the mouth. Again, at this point here, we're checking the patient's oral hygiene. We're capturing the BPE if needed. We're noting any periodontal issues at this stage. And then as we go a little bit further, we're looking at this point, we're looking again, mobility and recession. So these are all the things we're looking to capture during the consultation. Oh, and by the way, we do take photographs of every patient, and we take the photographs in a sequence that I'm talking you through here. And then the other part, what do we want to capture? We want to capture the incisal relationship. We want to capture the dynamic occlusion of the patient, canine guided, group function, or where the protrusive guidance is. All of these are things we need to capture. And then finally, we need to capture the status of their current dentition, so that we have a benchmark as to how they turned out. We can communicate this with other parties involved, referring dentist as an example, or with the patient, as an example. And then we move on to doing a localized assessment for the site. And here, when we do the localized assessment, you'll see the factors that we look at that are now templated, so that there's basically a systemized way of capturing all this information that we need in order to treat the patient. We also might do some further assessments, not this type of assessment here, but, for instance, ethyl chloride, check the vitality of any neighboring teeth, look for As that, we might take some radiographs. This isn't one that we treated at the practice, but we might take radiographs as needed. And we also might take 3D scans, and you'll see how all of this can be looked at and reported on and gathered within Kiroku so that we can get all the information we need in one go. And really, once we've gathered all the information, this allows us to start the stage of diagnosing and treatment planning for the patient. So if we talk a little bit about how we can use radiographs, this is something that we've recently started using at the practice. It's called Pearl. And what this is really, really useful for is when you get your 2D radiograph, this is automatically uploaded onto the cloud. As it's uploaded onto the cloud, AI then looks at this radiograph. As it looks at this radiograph, it will pick up any features. So you can see here what it's picked up is that the 5 has a deficient margin. Sorry, the 4 has a deficient margin. There's caries underneath the mesial of the 7. It's got distances, so we know has there been bone loss, in different areas of the mouth. It also allows you, and this information is outputted with these nice clear boxes that you can see on the right-hand side, and you can see their pathology, calculus, margins. It also can tell you what's there. Is it a crown? Is it a filling? It can measure things for you. It also, in order to help your diagnosis, it can draw things like that, recolor your radiograph, so you can clearly see where the pulp is, and you can see the dentine. This is really, really useful for sharing with patients. And again, one of the suite of AI tools that we find really useful within the practice. So that's Pearl software. And it just allows us to look at the radiograph and see it better. And one of the things that we noticed in the practice was with the advent of digital radiographs, it's sometimes really, really hard to tell the subtleties between all the different levels of gray. Is it demineralization? Is it burnout? How do we know? But having something like this, it doesn't plan for you and you have to clinically interpret it, but it draws your eye towards things that you might want to look at a little bit more closely. It also means that it's easier to explain to the patient what they're looking at and what that bit of gray means. So really, when it comes to treatment planning, you have to really try and work your way through these. These are only 5 of the things. There's more with each patient. So you have to work out what the patient wants, which they've come in. You've captured that by asking them at the beginning what they need. You hope that what the patient want and the patient need are the same. Sometimes they're not. You've also got to factor in actually the timing. Can they take the time? Does it work for them? You've also got to figure out the cost, and there's a kind of grid and matrix, and also their tolerance for different procedures. So you almost end up with this grid where the middle that intersects is the perfect treatment plan. That rarely happens, but you can aim for it. And if all of those things are aligned and the patient wants, needs, the timing, they're happy to have the procedure, they can afford the procedure, all of this thing fits into one space, all of this hits one point that you and the patient are happy with, you can then carry on with your treatment planning. And again, I think tools like this really, really do help your conversations with patients, so that when you're diagnosing and treatment planning, having tools such as the one I've shown you and another I'll show you later really do help with our patient communication. It's a key part. So in this digital age, in this visual age, having things that people can see rather than trying to explain with using a small mouth mirror is a key part of it. Now, the other thing that we're able to use is software like this. What you can see here is this is smart design software where this lady's coming in. We're looking to do some work on her top jaw. As part of this, we use this software and photographs to visualize what we're going to do to her and to show her the plan for her teeth. And it means that when we start off, as you can see on the left-hand side, and we finish on the right-hand side, that's the beginning and end, we can take her through a process where we can show her digitally what's possible. We then deliver that as a provisional restoration and then as a final restoration. You can see all the steps and stages in this process here of giving her this implant-supported bridge. And the nice thing is at the end, the smile that you see on there is the smile that we predicted at the beginning. But again, this is where the technology comes into play. The other part, communicating with other dentists, and you can see here a couple of colleagues in the practice and referring dentists. And this is really where we're going to now touch a little bit on Kiroku, and I'm going to show you how it's used in practice, and we're just going to go through effectively a note writing session. So if we look here, this is a patient coming in, and as part of it, we're beginning the process. So I'll then pick on a particular document that I want to use. And when I pick on this document and click on it, what you'll see come up is it opens a window. And you'll see now here how we have the blocks that can be used in order to allow us to collate the information that we've discussed before. So you can see here, we can go through and we can basically start off by obviously selecting which nurse I'm working with, and then having selected which nurse I'm working with, we can then move a little bit further down on here. We can go through the patient history. They're referred by their dentist, their social history, smoking, alcohol intake, brushing, interdental cleaning. All of these things can be captured fairly quickly, as you can see, by just clicking. We can also talk through their chief complaint and what we're going to do to, what they've come in for. But having it in such a way that we're now systemizing this and making sure we capture everything, and actually capture it in a way that we're later able to use this information that we've captured to actually output letters to patients. We can capture their medical history, decide if we need to talk to the GDP. Then we reach the point where we're carrying out the extraoral exam, looking at the TMJ, muscle mastication. We then go through the intraoral exam and go through that. And again, within all of this, if there's ever a point where I need to skip it, I go to the bottom right where it says skip remaining lines and click off. Their biotype, mouth opening, periostatus, going through that, this at the time. So at the time I'm doing this, the nurse can be guiding me through this and saying things like mobility, and then I'll click, and then she'll click, depending on what I say, nil. And then from there, we might, for instance, look at recession, where they've got recession, and select the teeth where they've got recession, which allows me, again, just to make sure I capture everything about the patient in one go. And it also, at the time I'm doing this, it's guiding me, and I'm starting to, in the back of my head, form some sort of provisional diagnosis. The occlusal assessment, again, which we've talked about before, and we can capture their static and dynamic occlusion. We can look for evidence of parafunction. Do we need to carry out any over-erupted teeth? Are we going to reorganize? Have any teeth drifted? And then the other part is, what are the other teeth in the mouth like? So if there's teeth that maybe if they've been referred, I need to just note back to the dentist, or I need to watch if they're, if that's what the patient's choosing to do, we can note that. Any caries that's visible in the mouth, again, we can note that. You'll see this come later. Any leaking restorations, again, we can note that. You can see this person's lost an upper six. Are they wearing a denture? And then we get on to the local assessment that I talked about before. We can look at the ridge width, papilla present, pocketing present on adjacent teeth, adjacent gingiva. So all of these things can be captured all in one go. And this is really, at this time, is really allowing me to capture better notes quicker. And better notes, which means that I'm able to look at things like, for instance, how much attached gingiva have they got? Is there bleeding on probing on the pocketed teeth in and around the missing tooth, which is quite often what we see? Are there any muscle attachments? We again go for the biotype. And then when we look at special tests, what are we going to do? Are we going to carry out any pulp testing? How have the teeth on either side of the gap tested? How are any other teeth which I'm concerned about? How have they tested? We can do a control if we choose to, again, to see if there's any change or anything that's happened to the teeth on either side. And then it comes to the radiography. When I'm looking at the radiographs, I can then look at the radiographs and grade them. So for instance, if I've taken a PA, I can go through the grading process and look at the teeth on either side and systematically go through and look at them. Caries, radiolucencies, any bone loss. Is there enough bone height? Are the roots inclined the right way? Is there any complicated anatomy? Anything? And again, if I've taken an OPG, you'll see again a percentage of bone loss come up here. If I've taken, you'll just see there's a grade there. Right, and here, when I've taken an OPG, we can grade it. I can have a look at any areas of caries, any radiolucencies, amount of bone loss, amount of bone present, root inclinations, any other findings. If I've taken a CBCT, again, it allows me just to do, again, a very, very simple report on this. And the reason why I've taken that here to look at the sinus, and then you'll see as I click through, have I done this? What size? Have I gone through? And this, again, a checklist. Have I checked the pathology for sinus? So as I'm doing this, I'm able to actually systemize my reporting on these radiographs and to go through there. And it means at the end of it, I get effectively a nicely reported radiograph. And then if I've got any periodontitis, I can then click on here and it will update that and open up a diagnosis for their level of periodontitis from there. It also means that at the end, I then can talk to the patient and actually work out, okay, now I'm talking to the patient about their options for replacement. And I can go through and make sure I've documented that I've talked to them about all the other options that are present. I can also say, okay, what have they discussed? What have they chosen? They've chosen an implant-supported crown to replace the upper right 6. And what procedures am I going to have to cover? This will be delayed placement. And I've explained the risk of any sinus or nerve damage. You can see that. And then on the patient wants to proceed, you can see here, one implant, or an implant-supported crown to replace the upper right 6. Clicked on nicely there. It means I can then go through, and then now I've got an idea of what I'm going to do. Diagnostic wax up, CT scan, nothing needed. No graftings needed in this case. It's going to be delayed placement, and then where the implant's going to go, and am I going to make a temporary tooth or not? And then also, what has the patient decided? Have they decided to go ahead? Now, this is where the magic happens. Once I've captured all of that, I can then go, and there's two things. One, you can see my notes, and the other part is a patient letter. I can click on that, put the patient details in that you can see come up here. So I'll enter a set of patient details. Sorry, you can't see that. It's just slightly off screen. That will come up. And you can see on the right-hand side of the screen there, that letter that's generated is off a template that I've given Kiroku that is the letter that I would normally spend hours writing. And that letter and that template, you'll just gets populated and prepared. And it suddenly enters this. And you can see here, suddenly, it was a pleasure to speak to you on the date. You've decided you'd like to look at having an implant to replace whatever tooth. You can see that actually all of the things that are relevant to this case, for instance, because it's an upper tooth, I'm not going to mention nerve damage to the ID nerve. It would automatically detect that. It will look at what I've decided to do an implant-supported crown. It will look at the process. And this is the treatment letter that I would normally output. And this now is automatically on there. And it's used the logic of what I've put in before to actually inform the letter that's sent to the patient. And even better, I can now click on here, download that as a PDF, or download it as a Word document. And even better, or something that's coming, which I'm very excited about, is maybe even email this to the patient so that they can sign it automatically. So this can happen at the speed of light. And this is the letter that's been generated that you can see here that I've downloaded. You can see that actually within all of this, the process of collating the information, making it easier for us to diagnose better and quicker, making sure we've got all the information. And then with one click, with literally one click, we then output a patient letter. And this patient letter is now ready to go. And the patient can look at this. And from there, start the process of signing it. That allows this to work so much more smoothly in practice for me. I've also got a set of notes you can see there with the report from the CBCT, and it also talks about the teeth which I've advised them to deal with, advised to treat caries teeth, advised to treat defective restored teeth, and I've got really some very thorough notes from that session. Now, that's Kiroku Docs, the ability to take your notes and to turn your notes into a Word document or PDF document that is personalized for that patient and follows logic. When I say logic, I've explained one. If I'm replacing an upper tooth, it's not going to talk about the ID nerve. If I'm replacing a lower tooth, it's not going to talk about the maxillary sinus. If I'm doing an overdenture, it's going to give me the information that's key for that particular treatment that I'm offered. This is based on a series of templates that I've got that I've used for a long time. And these have been given to the people at Kiroku, and they've worked out how to turn that into, with logic and artificial intelligence, a document that is downloadable, emailable for signing, printable as well. So really, that's a huge change. Now, I mentioned one of the other things I spend a lot of time doing. I spend a lot of time writing letters to referring dentists. Now, with the same workflow, you can see here, I can click on GDP letter, and in 2 seconds again, GDP name, the patient first name, patient last name, and within that, the same information that I've added to the first set of notes that I've done with my nurse is now a letter to the referring dentist. It's there, it's ready, it's usable in that amount of time. And if we talk about efficiency, the amount of time that's going to be saved with a workflow like this, I'm lucky enough to have had a trial of this. This really is going to be a game changer, because the ability now to download or email that to the referring dentist at the beginning, middle, or end of treatment really is going to be such a huge time saver for us at the practice. So that's the magic. That's Kiroku Docs. That's what it does. It's going to buy you and me time. Right, now it wouldn't be a dental webinar unless we showed some dentistry, would it? So we're just going to take a minute to look at a case and go through this. And we've also talked about assessment and treatment planning, etc. throughout this. And then we're going to just finish off with a little bit on what to expect in the future. So this is a lady who had an unfortunate accident with her Brompton bike. Her folding bike folded while she was cycling on it, and she hit the face with a pavement. You can see the upper right too is damaged. That's her pretty much on the day of the accident. That's her after a little bit of healing. There's been a very, very basic repair to the upper right too, which we need to replace. That's her after she's looking a little bit better. The scars have healed. Everything's looking a little bit better. We've obviously been able to go through the process of noting this all the way, doing endofrost on the teeth around it. And she's at the point now where actually we should be able to do something. That's the patient after everything's healed. Photos, thank you very much, Jessica Huang, for this. And that's the patient before we carry out the treatment. Now, what I'm going to do is just quickly show you the treatment. So the patients come in. We know that the upper right tooth is fractured subgingivally, especially palatally. We've been able to remove that fragment fairly easily. We use something called a Bennex root extractor to extract the root, as you can see there. We use a small pilot guide to make sure we put the implant in the correct position, follow through with a series of osteotomy drills to widen it, check our angulation is correct, place an implant into the correct position, and by actually using the technology guided surgery, we're able to place the implant again, as you can see, a little bit more efficiently and in the right position. From here, we're then able to, again, just make a temporary tooth for the patient, and we're able to use this shell that's been copied from the tooth that was there before, and just pick this up, doing a little internal pickup technique that you'll see now. So the shell is made of composite. The material we're picking up with is composite. And again, just by putting it into place, light curing it, and again, unscrewing it, as you'll see here, we're able to, again, pick that up, a little bit of a connective tissue graft into place. Again, this is to help with the aesthetics later on. And from there, the temporary crown is made and fitted from there. And really, it's just showing a little bit of dentistry for you, and how, again, just technology and how we're able to use that in practice. So again, sealing up the access hole, you'll see now a picture of the patient at the end of treatment. You'll see there. And you'll see the implant in place there. And then you'll see the patient after 2 weeks of healing, which you see there. So that's the lady, and that's a really nice picture after how she turned up. Nice high smile line, big broad smile. Temporary tooth looks reasonable as well. Temporary composites that have been done look good. And we look forward to completing her treatment in the practice. That's, again, a slightly closer view of the same thing. So we wouldn't be able to talk about AI without talking about ChatGPT, the most complex software object that humanity has yet produced. And this is a slightly older version of ChatGPT, but I asked it how it thought it would benefit healthcare. And this was after I'd written the 5 or 6 things. So medical research, diagnosis and treatment planning, patient education, and, you know, in some ways it's saying all of the same things. And I know for some people, the advent of these large language models and seeing them in action, generating all this text, can be a little bit frightening. And I think when we're looking at AI, one of the things to remember is that we have faced barriers with technology. For those of you old enough, you might remember the Y2K bug. You might remember when the world was going to end and planes were going to fall out of the sky. and all of this stuff was going to happen. And I think we dealt with it as a society in probably a very mature way that meant that we didn't end up having these issues. But I'm hoping that, again, as we reach the point where we are using this technology, using artificial intelligence, that we will hopefully, as humanity, actually reach the point where we come to a consensus on what we can use this technology for, because this technology can be really, really beneficial. It can also be really, really harmful. And we're going to need to develop a type of digital intelligence, because as we see deep fakes and all these things around, which are going to be much more easily generated, we might reach a point where it's so easy for a large language model to generate text and information that it becomes hard to know what to trust online. But again, we're going to have to develop this, and I'm hoping that systems will appear. But one of the things we know with technology, that change is inevitable. The march of technology will continue with us or without us. We know that with all of these things, there'll be disruption, and there can be benefits and there can be harm when we get the disruption. But the thing we have to remember, if we look at a couple of companies that did not adapt and did not change, this is one of them. I remember arguing with my wife whenever we went to the Blockbuster. We'd spend an hour arguing about which movie, and eventually she would win. Now we spend an hour arguing about which movie on Netflix, and she still does win. Another one, Kodak. Kodak did not adapt to the digital age. It thought that the digital age was not going to be relevant, and it did not change at the time it did, at the time it should have. Other companies, have overtaken it, and it's largely obsolete now. So the key part we need to take away from that is we need to adapt as change arrives. And if we adapt as change arrives, this gives us the best chance of using this technology to its fullest, of our businesses thriving rather than surviving. And the lesson from this, I think I take from this, is that there's technology you can use now in practice. I've shown you 2 or 3, and the one I'm talking about a lot now is Kiroku, that really can help you in practice and help you do better notes faster. Not only that, output letters to patients, output letters to referring dentists, output consent forms. Think about every time you talk to a patient about whitening, that automatically a whitening consent form goes to the patient. The implications of being able to use this technology for you in practice is going to be huge. This is the final slide. So for those of you that want to know a little bit more or want to contact me, there's a QR code there. You can find me on Facebook, Instagram. I've got a little website if you want to know more. We run courses. You've seen some stuff about some digital dentistry and implant dentistry. We run courses, which you can find out all about on there. But really, I think it's now time for me to rejoin Hannah and to be available to answer any questions. So thank you very much.
Martin, thank you so much for that. That was very, very interesting. And I've got a couple of questions myself first, just to kick off, if that's okay. My first question is actually on the clinical case, and apologies if this is a stupid one. Oh, I think my camera hasn't worked.
Yeah, hello.
Perfect. Which is there, and apologies if this is a stupid one.
No,
is there
no,
a
please don't.
where you would have tried to retain that upper right too? I know it had a root fracture, but is that would that have been an option even if it was?
In that case, no. The reason being, if you looked at the video, it was fractured subcrestally, so below the level of the bone, palatally, and quite a long way palatally. And that's the reason I had to use that gadget to actually take it out, because I couldn't have gripped it with forceps. So the tooth would have, although yes, restoration would have been possible, it would involve either extruding the tooth orthodontically and then preparing root treating it, extruding and preparing it, or removing bone on the palatal aspect enough that you can get a margin on it. And the difficulty with that is, if you looked at the size of that root when it came out, it was a tiny root. So we're only really, I feel in that case, with all of those treatments, returning to the patient in a short amount of time to say, oh, now we need to do the implant. So that's why. What's nice is the other teeth all survived and were all salvageable, despite obviously the trauma. I think that lateral took the majority of the blow and shattered in half. So it saved the rest of her teeth.
I'm glad that she had such a good end result. I unfortunately suffered a bike accident myself and had some dental trauma too. So,
Oh, okay, all right.
and I've got a second question as well, which is, where do you see the technology, whether it's where do you see it advancing specifically in dentistry? These are examples of stuff that we should adapt to, but is there areas where you see a gap, where perhaps technology could fill?
No, I don't see a huge gap anywhere. I just think that there's certain things that will happen better. I think I mean, let me give you an example. We all have, as dentists, thousands of inactive patients who've been given a treatment plan, right, who don't return. In order to get to those patients, we have to physically look through the list and then contact them, and we have to remember to do that. We have to remember to do that. So I think that there's areas within using our practice software and marketing which can be made so much more highly efficient with AI. Imagine an AI running around and figuring out, and also imagining understanding your way of treatment planning, looking at the radiograph when it pops up onto Pearl, saying, I know what Martin's going to do. He's going to do X, I'll put the provisional treatment plan there, and he can then adapt it and move it. So I think within our practice softwares, I see that's really an area where I think there's a huge gain to be had through really working on practice software and artificial intelligence.
Super, thank you. We've got a question, which is, how widely is Kiroku being used in NHS dentistry? And I can answer that one and jump in there, which is...
Please do.
Which is, we have a lot of NHS dentists who use the platform. The benefit to NHS dentists is ever so slightly different to sort of dentists like Martin, who are doing far more complex things, requiring that communication, patient communication with every single patient. But actually the kind of efficiency gain and the quality and thoroughness of the notes to ensure that is, everything is being captured, particularly when you're in a rush. That's when you can miss things. So the benefit there for NHS dentists is slightly different, but yeah, we have probably reflective of how many NHS dentists there are in the country. That's probably similar to the split of NHS dentists on Kiroku. And then we've got another question, which is, can exact dental software run together with this program? And I can answer this for Kiroku. I can also answer it for Pearl, I believe. But obviously Pearl is slightly different in that I think Pearl integrates really well with the radiographic image software. So I think that has got a tighter integration. I can speak for us and say, actually, we run in Google Chrome. It's separate from your practice management software, but it can work alongside any practice management software, because very simply, once the notes are completed on Kiroku, you click a button, you go into the text box that you'd usually be writing your notes in, and you would be able to then just paste them in. So it's very, very simple, but yeah, it does work alongside Exact.
Hannah, I'd also say something else, which is by having the ability to output the letters in that way, you can effectively copy and paste them into your Exact template, would be one thing. And also in terms of your consent forms, by being able to populate them really quickly. So I think there's additional intelligence that Kiroku has that may be software of excellence, even though it allows you just to put the name and address at the top of any document. Kiroku can be a lot smarter than that. Because of how it's built and the logic behind Kiroku docs.
I've got a question for you from one of the attendees, and I hope this means more to you than it does to me, which is, what is your take on navigational surgery?
Oh, that's a very good one. What is my take on navigational surgery? So for those of you who don't know, what you saw me do was guided surgery, where we do the planning virtually, and we get a sleeve that allows us to place the implant or to put the drill in the right place. So for navigational surgery, you have effectively, I'm going to call it a robot, because it kind of is. It is a robot. You have a robot that's in your surgery that sits beside you. And once you've done your planning, you attach a sensor to the patient, and you attach a sensor to the handpiece that you're using. And as you attach the sensor, as you're drilling, the robot guides you in the right way so that you make the hole in the right place, and it gives you a target to hit. My take on it is, I think I know people that use it and really like it, and the people that use it and really like it rave about it. I think it's quite a large investment for something where I've already got a system I really, really enjoy using. And the other part is I can't get my head around drilling over here and looking over there. That feels so alien to me. I've tried these several times. There's another one called Yomi, which is available in the States that I've tried, and the one here is Navident. I can't understand looking in one direction and drilling in the other. It doesn't compute in my head. So I prefer to look where I drill, is my take on that. But many people are happy with it that use it, that have made that investment.
Wow, that sounds quite like mind bending to allow.
It is. It's the looking one way and drilling the other. Looking at the screen and drilling. But
yeah, that would definitely scare me. I've got a question which is about Kiroku, but I'm actually going to hand this one over to you, Martin, if that's okay. Which is, do your nurses need training on the system?
Oh, about 2 minutes is the answer. Can they click the box? So yes, the first time you'll have to talk them a little bit slower when you say click this, and yes, when they start off, no, this button and that button. But once they've done it once, they actually prefer it, because actually you're doing most of the work. They're just reading out extraoral, TMJ, intraoral, lip line, smile line, and they're just reading it out to you. It also means that they really feel involved in that part of it, rather than you sat there. I don't know how. The funny thing is, I'm thinking about, I think in the past, we would have something on SOE and they'll have to type away, and we'll be waiting for them to type, and then you'd have to go back and correct everything, redo it. They'll forget something. The spell check would do something weird. Whereas now it outputs the notes that you've designed for it quickly. But I think the other part of that I really need to say, and this, I think you need to work with it the first time. The setup is, if you sit there and you spend time, it's one of those things where you've got to slow down to speed up. If you spend time interacting with the program, deciding how you want your notes, what you want your workflow to be, then actually that really will speed you up. And I think one of the things that's really handy, I've stolen some of the templates that you've already got on there, for instance, rather than create it myself, and just grab that. I think there's one for extractions I looked at, and I thought, that's a lot better than mine. So I grabbed that, changed one or two things, and suddenly it's, someone's done the work for me. So I think the templates are really, really handy and are very useful.
I'm pleased to hear that. We've got a question which is, have we considered the use of Kiroku in dental hospitals for specialist care? It is, ongoing. And actually, I will reach out and see if that's something that would be useful in the hospital setting that you work in, to the person who's asked the question. But it is something that we are exploring. I think that might be all the questions. If there's any more questions, people, please do feel free to send them in. But there's lots of thank yous for you, Martin, and for a great lecture. Oh, yeah, sorry. I've actually got one more question, which is, what is the role of AI in endodontics?
Oh my God, AI in endodontics. I could speculate, but I imagine with a 3D scan of the tooth that it could calculate exactly because I think what I'm seeing a little bit more now is guided endodontics. So 3D scan, figure out where you need to make your initial access hole, especially if you want to do minimally invasive endodontics. Get a guide made, and that guide allows you to first of all drill with the handpiece through. Then when you put your first file through, put it in the exact position. So as you're going down, and also with that, you can imagine you can have some sort of depth control. So with that, imagine that your AI calculated out of thousands of successful and failed RCTs the ideal shape of the canal and the number of the drilling protocol that you should use to achieve that. And then effectively said, right, there you go, John, here is your guide. Here is a sequence you're going to follow. Go ahead. And we know that that's going to give you everything as best. So I think it can really help you with planning and shaping, a little bit like we use it for drilling in implantology. I can imagine that at some point endodontists might use it for shaping and obturating.
Interesting. Lots of thank yous, and an extra thank you from me as well. That was fascinating. That was awesome. Thank you.
Oh, thank you, Hannah. Pleasure. And it really has been a pleasure being part of the Kiroku journey. And, you know, I said it before, the first time I saw the product, I thought, wow, this is really, really going to be useful to me in practice. And I hope by doing this and talking, it helps many other people just to take the leap and to take the step. And with all of this, I know, you know, Hannah's not said it, but they do offer a little free trial. Do consider doing that, because if you do that and if you actually work with it, so when you get it, don't just wait until the last day of the free trial and then go on quickly in a rush. Try to use it for the first week or so. And I suspect, like the dentist who works in our practice who found that it saved her an hour on average per clinical day, that there are savings to be made in your time so that you can do better things with it. I like making presentation, fiddling around with other things, so you can do with that time as you wish.
Thank you so much for that.
Right.
Good night, everyone. I hope you've enjoyed the talk.
All right. Bye.
Bye-bye.